Hi, my name is Robert Hay, and welcome to the Power of A website. With us today is Scott Becker of the Association of Public Health Laboratories. Now, Scott, swine flu, or more accurately H1N1 influenza virus, has been getting a lot of media attention recently with some dire predictions. What is APHL doing to help with this crisis?
Actually, a lot. The association itself has stood up our Emergency Operations Center. We're in close coordination with the Centers for Disease Control and Prevention and the Department of Homeland Security. We're providing technical assistance for our members, so we're troubleshooting some technical issues with either the assays or the instruments or the materials that they have to use for testing. We're conducting just-in-time training, and we're collaborating with our border partners, so we're in close communication. A lot of what we do is being in touch and connecting with folks. We're also up on the Hill talking about what the role is that the public health laboratories play in an outbreak such as this.
Great. Now, obviously public health is a lot more than just influenza. It extends to things such as foodborne illness. How does APHL get its members to participate in its major initiatives on any subject?
Well, actually, let me go back to flu for a second, because I want to give you an example of what the members are doing right now. So the association is standing up our EOC and the things I talked about, but what the members are doing is testing. They're testing for any drifts in the virus throughout the community. So they're working closely with their clinical counterparts and also with CDC, of course. They're cross-training their own staff for surge, and basically they're working round the clock. So that's what they're doing. So that's what they do during an outbreak such as this, or as you say, foodborne. It could be any number of issues, from anthrax to foodborne outbreaks, anything. They're constantly on the on the edge of protection for the country, so to speak. It's not hard to get them involved at all. Over 30% of our members are actively involved on committees, task forces. They serve as mentors to our fellowship program. They could be found in any of 17 countries that we work right now in developing laboratory systems across the globe. So it's not a problem.
Great. Now, we've talked about some of the major issues, H1N1. What is one issue that maybe isn't getting as much attention as it should in the media or in the public eye?
It's a great question. One area is it's kind of a bit of a surprise, and it's the area of electronic laboratory reporting. We've been making some progress with that, but you would think in this day and age, when you can take your ATM card and go anywhere in the world and go to an ATM machine and get currency out, that your lab report would be electronic. That's not the case. We're certainly working hard to make that the case, but it's not. And that's something that I think with the new investments through the ARA funds and stimulus and other kinds of things, we're looking forward to see public health get connected. One last thing, actually, I'm going to go back to flu because it's such in the news. I think associations need to, again, think of themselves as businesses. So CDC has some great resources on the CDC.gov website. Click on the flu site, or go to flu.gov. There's resources there. And then the other thing that I always carry is hand sanitizer. I think everyone really needs to think about when your employees look ill, send them home. Come up with alternative approaches. Consider things like telecommuting. Now's the time to put those plans into place.
Great. Well, thank you for having a good discussion on a couple of very important topics today. Keep tuned in to the Power of A website for more in-depth discussions on important issues with association executives.